discuss the president's historic drug deal is Dr. Mehmet Oz, the administrator of Medicare and Medicaid Services. Dr. Oz, thank you so much for being here with us.
Batya, I like that framework, and it is remarkably accurate. And I'll just take my personal experience working with the president. I've known him for many years. I've seen him do this in other walks of life, but this most favored nation pricing that we're going to talk about today was a good example. We were told it couldn't happen. The president was undaunted, didn't care. In his first administration, he tried to do it, and he laments the fact that he got a 1/8 of 1 point benefit improvement in prices, and he thought that was a success. And he realized we just have to blow the whole system up in a way that can be reconstructed more artfully. He aligned everybody. He introduced me to the head of Pfizer early on, even before the inauguration, and said, you guys are going to be working together, get to know each other, because you have to build on that little kernel of that ember of heat between all of us and making a real fire so we're aligned.
President Trump said something last week during shutdown negotiations, very interesting. Nobody likes Obamacare. It was reported that he said it's expensive, bad coverage. What we should do is write a new health care program. Could we see President Trump pursue something like Medicare for all?
I think the president is very thoughtful about all the different ways we can help address the challenges to the ACA. The Affordable Care Act was designed to catch people coming off Medicaid and help them get into commercial health insurance. It's unfortunately filled with lots of flaws, but there is no point talking about this program or any other ideas until we get the government back up and running. I mean, I'm sitting, in my office, but I don't have a lot of staff like we usually have, a beehive, people running around doing things to help the American people. That's vitally important because some of these programs like telehealth, for example, people live on these programs. They rely on them. When you shut the government down for political purposes, you hurt the American people. And this is the real focus, I think, right now of much of what you're hearing coming out of Washington. Why are the Democrats doing this? I don't understand it. It's literally a 7-week extension of the budget so that we can negotiate some of these other issues that they're concerned about. And I get it. They've got things that they want to get on into the bill that ultimately might get passed, but it's not going to happen this way. There is zero chance Republicans are going to bend on these themes. Keep the government open like it's happened so many times in the past. Let's, in an orderly fashion, discuss all the opportunities to help the American people, but only after we have a government that's functioning and we have people around us.
And the Democrats claim that the shutdown is about, tax credits for Americans, for vulnerable Americans, and access to health care. The Republicans say no, it's about keeping illegal migrants off of the Medicaid rolls and off of having access to government-subsidized health care. The Democrats then respond and they say, well, actually, illegal immigrants can't access Medicaid. But that's not actually exactly true, is it, Dr. Oz?
Batya, your monologue was very accurate. And unfortunately, illegal immigrants have been able to access Medicaid. But more importantly, they've been able to access Cadillac Medicaid in California, where you get dental and vision and all kinds of other benefits that aren't part of regular Medicaid programs in other states or Medicare anywhere. Right? In Medicare, older Americans who work their whole life and put money into the system, they don't get free dental unless they sign up for Medicare Advantage. So it's a weird dynamic, but states were able, like California, were able to figure out that they could pay for illegal immigrants and give them fantastic high-level service, better than most other Americans get, and get the other Americans who weren't getting those services, who are rightfully here, lawfully present, to get them to pay the bill. So when we actually got serious about this and messaged that we were no longer going to do this, and the One Big Beautiful Bill codified that, guess what happened in California? They stopped offering those services. Because it was nice to do it if it was someone else's dime. But when I'm paying, I'm not so nice anymore. And I think that's the fundamental reality. This shutdown, I believe, is purely political. The reality is the Democrats cannot possibly think we're going to revisit a bill, the One Big Beautiful Bill that we worked so hard and so thoughtfully to get through to save Medicaid, to deal with the fraud, waste, and abuse that was sinking this beautiful, wonderful program that helps so many Americans. And now that we've saved it, we are not going to retrace our steps and give up some of those safeguards to keep the program both fair and viable.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.